but we will go ahead and get started. Welcome to the Community Pharmacy New Revenue Roundtable. My name is Breck Rice, and I'm one of the co-founders of ServeRx, and it'll be my pleasure to kind of walk you through some of the solutions that we've identified to help our community pharmacy partners. I've been working with community pharmacies for over 20 years, started back in 2023. And absolutely love our community pharmacies and the patients that they serve, and will do everything in my power to help you be successful. And so that's why we put on these roundtables, is to help you. We know how bad it is out there with the poor reimbursements on medications. We know about the DIR fees, and so we're here to provide solutions to help you with those problems. So, but here's the number one problem. This is what I saw several months back, article from Fortune reporting that for the first time in our history of the country, we've dropped below the 20,000 independent pharmacy level. And the big reason is because of the profit margin. So back when I first started in the industry, it was 36% in dispensing margin, and that's a fair margin. Now today, with PBM contracting, it's as low as 3%. And so it's pretty hard to stay in business when about 1/3 of your prescriptions are being dispensed below your acquisition cost of the medication. So that's pretty hard to stay in business when you have so many medications that you're having to dispense at contracted rates that are below even the acquisition cost. The new federal rate, not because of the Department of Labor, this is 100% on Optum's shoulders, because the PBM that was managing that account before had a fairly fair reimbursement rate, but Optum really wanted the Department of Labor business, and so they undercut the competitor, the incumbent PBM, and brought in pricing that the federal government had to just look at and say, wow, this really helps us save millions of dollars. And so they went with it, not knowing that there's going to be a trickle-down effect to access, or their postal workers and other federal workers being able to get their medications, because the new rate that Optum has is minus 88% of AWP. So absolutely ridiculous. And I don't see how you can, an independent pharmacy can even manage that price point. So many pharmacies have started to give up and close their doors. Here's some examples, some really sad examples, because these pharmacies have been around for 80, 106 years, that ended up just closing their doors, and now that's creating a pharmacy desert in certain communities. Here's a list of even more recent closures. Because ServeRx is partnered with all of the PSAOs, we get those updates on a regular basis of what pharmacies are closing. Here's the next big problem is the DIR fees, the direct and the indirect remuneration. Absolutely ridiculous, the increase from 2010 to 2019, over 91,000% increase. So that's like paying over $3,600 for a gallon of milk, to put it in perspective. So completely ridiculous, and no pharmacy can even plan for what those clawbacks are going to look like in 2024. And so we believe that community pharmacy really ought to focus on getting at least 1/3 of their revenue to be non-dispensing revenue. So that needs to come from other programs, other non-PBM related programs, and front-end cells, which we have some great examples for you today, as well as more clinical solutions, and I'm going to share some of that with you also today. But first off, the very first program that completely bypasses PBMs and helps community pharmacies get a fair reimbursement is the ServeRx program. There's a short little explainer video that I'll show you here shortly. One of my favorite ice hockey players of all time, Wayne Gretzky. I spent a few years in British Columbia, Canada when I was a little kid, played Pee-wee hockey. And Gretzky was the man. He was the guy that we all looked up to, at least in my team anyway. And when interviewed and asked what made him such a great player, this was the famous quote that you've probably seen before, that he skates to where the puck is going to be, not where it's been. And as community pharmacy service providers, as community pharmacists, we need to go to where the puck is going and not where it has been. And so the solutions that we've brought you today are doing that very thing. It's going in the direction of where the industry is going, and don't stick around and do the status quo, because that'll absolutely kill you. Here's the quick little explainer video on the ServeRx program.
An injured worker comes into your pharmacy. What do? Do they have a PBM card? Who is their carrier? Will I have to make a bunch of calls to find out? Will I get paid? And if I get paid, will it even cover the cost of the drugs? Don't worry. Just send the claim to ServeRx. They will do all the work, guarantee payments, and you will even make more. Less work and more money. What do you have to lose? You are probably already contracted through your PSAO. All you need to do is enroll. www.serverx.com.
So here to tell us a little more about that program is my friend Will Shaw. Will?
Hey, great afternoon, great morning, depending on the region you're at. My name is Will. I'm an account manager for ServeRx. And like the video said and Breck said, we partner with every PSAO that's out there to be the preferred processor for workers' comp. No affiliations with the PBMs. And as you look at this chart right here, you can see a few examples. I love to use Meloxicam because I see a lot of pharmacies that I deal with process Meloxicam. So if a patient comes into your pharmacy, they need a Meloxicam, and if you was to process that Meloxicam through a PBM, your pharmacy may receive $3 to $4 for that medicine. But if the pharmacy was to adjudicate through ServeRx's Ben and PCN, your pharmacy could receive anywhere that I'm seeing anywhere from $101 to $105. And I actually had a pharmacy this week that I enrolled in Texas, and they actually called me back and couldn't believe that they was receiving $105 for Meloxicam. And how ServeRx reimbursed the pharmacy is of AWP. So for brand medications, we reimburse the pharmacy 85% plus a $2 dispense fee of AWP. Then for generic medications, we reimburse the pharmacy 70% plus a $2 dispense fee. And that will be reimbursed to your pharmacy in 30 days through your central pay if you are with a PSAO. And if you're an independent pharmacy, we will reimburse the pharmacy 45 days directly from ServeRx. We do have a live help desk that's available 7 days a week. So if the pharmacy was to receive a rejection, you could give our help desk a call, and they can help the pharmacy receive that paid label right then and there. Okay, like Brett mentioned, we have no affiliations with the PBMs. We're here to take the work out of workman's comp and help the pharmacy receive those fair reimbursements that they legally deserve.
Awesome. Thank you, Will. Appreciate it. And again, if you're not enrolled in this program, it's totally free to you. In fact, it actually costs you about $50 or $60 if you don't use our program. We understand you do have some contracts in place with some of the big PBMs, and unfortunately, they bundle those network agreements. So if you want United Healthcare, Optum, of course, is their PBM. So if you want the 65 million patients in United Healthcare, they make you take their Catamaran, Cypress Care, all the other networks, and they bundle those together. So we understand that, but still about 1/3 of all workers' comp will be self-insured employer groups, and we can process those claims for the life of the claim. 50% of those claimants will have, 10 or 12 refills. So it's really, really profitable for pharmacies to put a little emphasis and focus on workers' comp. So that's about us and what we do. Wanted to introduce to you a program. I didn't see John. Is John here today? Oh,
I
there we
am.
go. John. Oh, excellent. Man, I didn't see you sneak in the room, but John is an expert. In fact, his team built WebMD. I think everyone's very familiar with that platform. And his team is responsible for other huge, hugely successful platforms like WebMD, and now is bringing us the RX Spark.
Yeah, hey, so yeah, we did build WebMD and basically put the user in the center of healthcare so they could find out all about the drugs and conditions and symptoms and all that sort of stuff and really become controlling of their healthcare and clearly successful. And as Breck says, we've created several platforms. We built a platform that runs Yahoo Money, basically aggregating all your bank accounts and credit cards. So we have a reputation for building sophisticated platforms that are easy to use. We got pulled in by a PBM called MedImpact to solve a circular problem in the industry. And 1 in 3 prescriptions issued by a doctor are not collected at the pharmacy, and that hurts everyone in the chain. Hurts a doctor because they're measured on medical adherence and health outcomes. Pharmacy doesn't get paid for putting the pills in the jar. PBM doesn't get paid the adjudication fee, and the customer doesn't get better. So we started looking at the customer and thought, why would the customer spend all that time going to the doctor and not collect their pill? They think it's too expensive. They've read about it in the press, and the 95% of the competition to RX Spark is a dumb card that says you get 8% discount at 62,000 pharmacies. That's like saying there's free beer in Phoenix without telling you where the bar is. And so they've become less and less used. GoodRx, clearly a great company, do real-time pricing. So we knew we had to do real-time pricing. So we built a platform called RX Spark, and it basically is more than pharmacy. It combines pharmacy with content regarding the drugs and conditions. It can add services on that relate to the drug and condition. You're diabetic, you might need an A1C test. You might need products that relate to that drug and condition, like diabetic socks and shoes and stints, and rather go to Amazon. It's all here with extremely competitive pricing. So we created a platform that competes with GoodRx, and we work with partners who have very large reach. Henry Schein is a really good example of that. We have Henry Schein RX as a platform. The community pharmacy is one of my advisors is a guy called Bill Barry's on the NCPDP board, and we're talking about community pharmacies and the problems that we're facing. And so we've created a platform called My RX Spark that is aimed to assist the community pharmacy. So we are cheaper than GoodRx because we've cut out all the costs of GoodRx. Use the NADAC pricing. They only charge $1.99 instead of $7. So we're very, very competitive. 95 out of 100 drugs cheaper than GoodRx. So now we're competitive. With the community pharmacy platform, it's layer upon layer of things that can make a big difference. First of all, we've created a platform called My RX Spark, and we know exactly which one of the community pharmacies it is because it's uniquely defined by our system and by the member ID. So that community pharmacy can sign up and basically get started by giving everyone a card, the My RX Spark card, which has their number on it, posters and cards, postcards and so forth distributed. And not only do the community pharmacies get their fill price, the money they've agreed with the PBM for putting pills in the jar, they get a share of the profit that I make from the PBM. So every prescription filled, you get more money. Every user can press a button and share it with all their friends and family, and those friends and family were more likely going to be out of state. It competes head on with GoodRx, better than GoodRx. So those people, those friends and family of all of your users can start using it, and you get paid when those friends and family get there too. Another layer says you're in the community and you offer a great value to the community. We can create postcards and cards for you that you can download and print and put those out into laundromats or churches or schools or clinics or doctors' offices and drive traffic to you. Again, another layer. Another layer says we can get in the back end of your software. Brett can do that for you, or you can do it and just get rid of some of these dumb cards that aren't making you money to make you money. When you add all that up and being very, very conservative of small numbers of users, the average increase per pharmacy is about $50,000 net profit a year. And that's simply doing it. I've learned a lot listening to Breck. Again, you know, I can spell Lipitor on a bad day. So you're not going to come to me for pharmacy advice. But the idea that you can make money while you're sleeping, it sort of resonates. It says once you've got out there, and the more posters you put up, and the more cards you give out, and the more that your friends and family of your users tell their friends and family, all of that is using your card. So while you're asleep, you're making money. And again, the 50 grand is quite considerable. And again, very conservative, very, very happy to share that. Easy to join through the video, click a button and join, and we're going to get started on that.
Yep, I've spammed the chat with that link. It's a live link to YouTube. Just click on the link. It'll take you to the explainer video for MyRx Spark. Amazing program, unlike any discount card. So it's a good deal for your patients, but it's even a better deal for you as the pharmacy. Unlike the other programs that actually, you know, cost the pharmacy money to run, this one makes you revenue, and it's passive revenue. You generate revenue even in your sleep. If you have questions for John, please meet him in the chat. You can chat him directly in the chat. In the interest of time, we're going to move on to Germs RX. My friend Scott Lampier, I love his products. It's pathogen protection. FDA says that it lasts for up to 4 hours, which means it must last 5 or 6 hours. I love it. Anytime I fly or go in any public area, I'm definitely protected with my shield. Even on flights with my grandkids, their wipes are so amazing. They're water-based too, so it doesn't hurt them. I can wipe both grandkids from head to toe and protect them because I know they're touching everything on that plane. But Scott, tell us more about Germs RX.
Checks in the mail, buddy.
Thanks.
Breck is one of my better cheerleaders. I really appreciate him. Germs RX represents the next step in how we need to kill pathogens safely, because the traditional things that we have out there that's recommended by the CDC and other organizations just are toxic. They don't do the job completely, and we want to feel comfortable. I think that's the biggest thing is I show people a way they can feel comfortable about being in situations that they're not afraid of catching something. And so whether it's hand sanitizers or soap or laundry additives or wound care, Breck mentioned at the beginning of the show that I sent a referral. We have a wound care product that works amazingly, but the science of it, the Zetracil is the trade name for it, is the proprietary nanotechnology, which basically creates a microscopic barrier on any surface virtually, whether it's your skin or countertops or flooring or whatever. And whenever a germ cell comes in contact with it, it gets pierced and then, for lack of a better word, electrocuted with the positive nitrogen molecule. There's nothing left of the germ cell. So one of the biggest benefits of these products is that they're not going to create any variants anymore, because there's no opportunity for a cell to communicate to its brother, hey, go back to the colony and tell them what's going on with this. So like you don't get antimicrobial resistance buildup. Here's a picture of some of our products, like the hand sanitizer on the left. I have an antimicrobial disinfectant that'll last a month or more. And I have studies and all kinds of things that if somebody wants to get technical, I can certainly provide them with that. And my updated website, I know I've been promising that Breck for a while, but it's finally going to come to fruition here shortly. And I really appreciate, I've been getting really good support with the group and just exciting things coming up.
Yeah, excellent. Thank you, Scott. And my son calls that protection, you know, those little, because we're talking nanotechnology here, 30,000
A
times.
billionth of a meter.
Yeah. But he all those carbon shards that are piercing the pathogen cell membrane, he calls those tiny swords. So whenever we're traveling, he's like, "Hey, Dad, do you have any tiny swords?" And I get out my little travel mister and spray his hands down and stuff before we travel. So please meet Scott in the chat if you have questions for him. This amazing product, really good profit margins on it, high 40s, low 50% profit margin, which is that
Yeah, we can set you up
keystone.
As a wholesaler. Yes.
Yeah,
Absolutely.
keystone price. Jonathan had a last minute call, but I can quickly tell you about this. This is a fun product that we actually launched here on the Community Pharmacy Roundtable, and we did the pre-launch on the roundtable, and then he launched officially at the last NCPA conference down in Orlando, and he filled up his quota the very first day. He could only supply to the first 300 pharmacies, and then everyone else went on the waiting list. Very first day of the conference, he had his 300 signed up. This is functional breath mint. So it has zinc in it. So it's actually doing more than just giving you a candy flavor or perfume flavor in your mouth or covering up through perfumes. This is actually functional. So the zinc eliminates the gases in your mouth that create bad breath. But if you remember the old Pop Rocks candy, it's that same technology. And so that popping and sizzling is also cleaning your teeth and gums. It's sugar-free, and it was the hit of the conference. Everybody was coming up to get this. So Red Bull was to the soft drink industry, it was a functional. It had energy and amino acids and vitamin B12 and everything. This is kind of the same process here with the blast of zinc. And they actually have a really amazing program too, where they're doing crowdfunding. And so there's a lot of community pharmacists who are also investors in this program, and then they'll actually get paid back 115% of their initial investment through the next round of crowdfunding. So they're ramping up their production now so they can supply to everyone in the industry, but really a fun product to carry. It's one of those that you put on the counter, and it's just a hot item. People just grab it up. It's hard to keep it in stock, in fact. So please reach out to me, and I can get you in direct contact with Jonathan on this product. Next up, we have Real Value RX, and Jessica's here to tell us about their program. We love this wholesaler. In fact, we have a few pharmacies that don't use them as a secondary. They're actually their primary, because the pricing is better than even the rebates that they get from their big, McKesson's, Cardinals, etc. But wonderful, wonderful people to work with too. Jessica.
Thank you, Breck, and hello to everyone. My apologies if I sound a little nasally. I came down with something this morning, so bear with me. So yeah, as Breck was mentioning, we are secondary wholesaler, full line generic distributor, but we do service a lot of pharmacies as their primary. There's tons of secondaries out there in the market, but kind of what separates us from all the others is we have a nice, healthy blend of, all of our retail medication drugs are very well priced. We do all direct net pricing. We do not work on a rebate model, which I love because it's all direct, transparent pricing. But then we also focus on helping pharmacies identify, drugs that adjudicate favorably. We help you market to doctors. We kind of really try to take a consultative approach with our independents, just to kind of uncover other ways to make revenue in their pharmacy. So that's pretty much, what we do. We do both. You'll have a lot of secondaries that'll either focus on one or the other business model, but we like to kind of tackle it from all sides to really kind of, go above and beyond for our independence. And then we also do 30 to 45-day net terms. We have next day delivery. We can, ship Saturday delivery. We're very easy to set up with as well. We just require, an application, a state license, just to kind of get you guys going. So we really try to acclimate to the buying style of the pharmacy as well. So we try to blend in that capacity. And then in addition to that, our reps we're not a typical call center where we're, calling every single day a pharmacy and that kind of thing. Again, we take more of a consultative approach. So we shine in that department as well. And then we also do, aside from, as I mentioned, the marketing flyers and giving you the tools to detail your doctors for profitable items, we also do have therapeutic interchange flyers that we provide. Breck has them, and he can kind of show you an example of that. And then we also have a partnership with EasyScript RX. They are a benefit check software. It's really the most unique software out there that really is a crystal ball into coverage. So that's also a very unique software that we do provide, and we can always schedule a demo for anybody that's interested and, kind of curious to see how that works. And that's pretty much it in a nutshell, unless anybody has any questions.
The materials that they provide you are awesome for detailing. So this one is on pain management, and it'll list products that are not only great for the patient, but they're been tested and proven as good reimbursement for the pharmacy as well. So love these pamphlets, and like this one is on pain management because that's what we do with workers' comp mainly, but they have other programs as well, and they'll provide you those materials that you can do physician detailing. Everyone should be doing physician detailing. You should be going out and meeting your doctors and your physicians in your surrounding area, because every time you do that, we see about a 14-15% increase in claims volume for the pharmacy. So it's definitely worth it. Thank you, Jessica. If anyone has any questions for Jessica, please meet her in the chat, and she can get you her direct contact there. I don't think Devang was here today. He's got a couple of sick kids, and his wife is out of the country right now. So I'll cover the pharmacy hub real quick. This is a part of the NCPA Team Up initiative, where we coming together as collectively as community pharmacies are actually the largest chain in the nation, and we can do some great things if we team up and we come together. Unfortunately, the smartest group I've ever had the opportunity of working with are our pharmacists, our PharmDs, their staff, brilliant people that really do a horrible job at marketing their services. Now, a few of you do great. I see someone on here that's actually active on social media. That's a unicorn. Most pharmacists are so busy buried in survival mode that they don't do a good job of digital marketing. This is a platform that basically combines 5 different services. At one time, we were probably paying for 5 or 6 different services to do digital marketing for ServeRx. This is one platform all in one place called the Pharmacy Hub. And, like I mentioned, a lot of our independents do a bad job at marketing their services. In fact, only 16% of independent pharmacies have an updated website. So this is not only a web builder, but it's also an easy way of keeping it fresh and updated. And using artificial intelligence, we'll even write your blogs for you. You just say whatever the topic is. I want to cover heart health, and here are the 3 key things that you want to focus on. And the AI will actually write it for you, and then you just post that blog. It's your patient engagement for patient outreach. So text messaging reminders for medication pickups or for getting their flu shots, whatever, and is that engagement, as well as appointment scheduling. This is getting used not only for your vaccination scheduling, but for clinical solutions that we'll talk about here in just a minute. It's your digital marketing platform. Sprouse Swiss or Sprouse Suite or whatever is a system we used to pay for. Sprout Social, where you kind of multiple. It's all built. It's a one-touch telehealth platform, and it is integrating a lot of other vendors. So definitely something to look into, and I can get you connected with Devon from Pharmacy Hub as well. The other product that you guys probably have already seen in your wholesalers now is BioLite. You can get that right directly through your major wholesalers. McKesson, Cardinal, AmerisourceBergen now carries this. Amazing product that is getting a lot of traction in the marketplace. It's everything that you would get in an intravenous IV, but in a drinkable form. And so it's a 550% more electrolytes than leading sports drinks. So it's also without all the sugar. I'll add too. They use monk fruit as the sweetener. So I would market this to high school sports teams and to colleges and universities as well, that they can get that through you. And then I wanted to talk to you real quickly about the Fountain of Youth. So this is the wellness clinical solution that is a plug and play, can be plugged right into any community pharmacy that has a consult room. So if you have an MTM or a patient consult room, you can put an entire clinic into that room, and the clinics are generating thousands of dollars in new revenue for the pharmacy. It is being done through virtual care, so telehealth, like we talked about with the Pharmacy Hub. And according to research studies, Will's study here shows that virtual care will surpass in-person visits. Prior to the pandemic, probably would still be a low adoption rate, but because of COVID and people actually getting used to meeting their doctor over telehealth, it's now widely accepted. And it's way easier to get a telehealth visit. So you may have to wait a month to get in to see your PCP, but you can get a telehealth visit in 10 minutes or less. Imagine, everyone's familiar with the minute clinic concept or the retail clinic. This is not that. This is the minute clinic on steroids because of the technology, the advancement, the patient wellness aspect of it, really focusing on well care and not sick care. And again, part of the Team Up initiative to bring our pharmacies together in a big cooperative that will be the largest footprint in the nation. That way, employer groups that are looking for wellness solutions will send their employees to your pharmacy and not to a competitor. The programs that insurance is covering today can't even get anywhere close to what what the wellness clinics are doing here. First starts with credentialing, doing what you already are doing, but actually getting reimbursed fairly. So if you already provide vaccinations like flu shots, here's one client of ours that did almost 10,000 flu shots last year. Well, he's getting cut back to pharmacy reimbursement rates for that. So his average flu shot was reimbursed at $17 per flu shot. Here in Arizona, a standard flu shot gets reimbursed for the clinics at $107. So 17 versus 107. In the states that this client's in, he'll get over $80 for flu shots, so that he'll turn that 167,000 into just under $1 million, doing the same amount of work, but now being credentialed as a clinic. and I can tell you more details about how that all works. Other mailbox money programs are the home health test. So my home health test is working on a public health issue right now. There are 12 million new cases per year for STDs, or they're actually called STIs now. So that's about 33,000 new cases a day. And we have a really fabulous HIMSS kind of solution, or discrete solution, for more people to actually get tested. The test kits can be drop shipped right directly to their home or their dorm. I mentioned dorm because about 50% of the cases are coming from that college age student college range. So whether you sell the kit at the pharmacy, or whether the patient just scans your QR code and the fulfillment company drop ships the test to them, doesn't matter. The pharmacy still gets the markup from the wholesale to the retail price on the test. Other testing solutions are being provided as well for, COVID, flu, RSV, strep, et cetera. So you can still take care of acute issues right there at the pharmacy, but you also have the opportunity to have more clinical services provided through a collaborative practice agreement. We can get more details on that. I want to show you this quick demo of a medical device that is also a part of the Fountain of Youth, because this is absolutely amazing technology, and it's the very first of its kind to have FDA approval. PEMF has been around for years. In fact, this very device has been used by over 2,000 professional athletes for almost 20 years. Big sports teams like the San Francisco 49ers use this in their training room. The Diamondbacks here in Arizona use it. Other teams use this, or a lot of individual athletes use this. It is endorsed by the NFL Alumni Association, because this technology also repairs nerve damage and microfractures. So imagine football players slamming into each other, creates little fractures, little microfractures, and this process actually heals those up. This is a leg muscle that I'm showing you here that's been blown up so large that this is one individual little arterial, bringing blood to one single little capillary off to the far left-hand side. And then the darker blood on the right-hand side is the veneal, taking the blood back to the heart and lungs to get more oxygen. So you're going to see here how lethargic the blood is moving into the microcirculation. That is what happens to anyone as you get older. That's why older people always have cold hands and feet, is their microcirculation is not working correctly. So this is going so slow that it's barely trickling in, sometimes completely stopping, but after only 3 minutes of stimulation, it is flowing naturally. And after 6 minutes of stimulation, it's like the Autobahn. It's flooding into the microcirculation, small vessels, and you'll actually see more activity here with the white blood cells. It's not producing any more white blood cells, it's just making it more active. This is 30 minutes after treatment, still the same benefit. So you don't have to be on the device to get the benefit. It lasts up to 18 hours in the patient. And so amazing tool that is the first of its kind to get FDA approval. So we can now, you can now bill insurance for it. Here are the 10 revenue streams from the Fountain of Youth. The vaccines that we talked about with the clinical billing, the My Home Health test, that's just mailbox money for you guys. It's another program just like RX Spark, where you're generating revenue in your sleep. The virtual care, which is the actual telehealth visit, pharmacogenomics or PGX. This is customizing medication approaches for each individual patient. And we are working on getting those tests down to a more affordable cost. Right now, only Medicare is covering it as from the insurance side, and so it's a cash pay for other patients. Medicare will cover it if the patient is on multiple medications and one of those medications happens to be either a psych med or a heart medication. The blood analytics tool is amazing. This is using artificial intelligence to identify problems with the patient that are not currently being identified today. When lab work comes back and the doctor reviews it, they have normal ranges that they look at, and if you're in that normal range, they tell you you're in a normal range, but you still don't feel like everything's right. Something is still going on. The AI in this blood analytics looks at 118 different blood markers. It literally can predict disease before disease happens. This is really cool stuff. You can make custom programs for the patient to improve those deficiencies and turn them around before it becomes a full-blown disease. And I can give you more details at a later date on that as well. The medical device has 4 different revenue streams. The medical billing for insurance. It is treated like a lot of musculoskeletal therapies where payers will approve 10 or 15 visits. And so then you have the option of doing the cash pay after that for patients. If you're credentialed as a DME provider, then the device can be sent home with patients that are recovering from injury or surgeries. And then about 1 in 10 patients want to have the technology at their own home. And so the pharmacy can sell that to them. Superior Wound Care is a brand new program that we're just rolling out. We just started with the first site in Arkansas with them. This program is so amazing with only 2 referrals a month. So getting doctors who don't want to deal with wound care, referring a couple of patients to you per month. It generates another over $30,000 in revenue to your pharmacy. Can you imagine having 3 or 4 or 5 doctors referring 2 or 3 patients to you? That can really start to add up 90, 100,000 per month in new revenue. So a fantastic program that I can get you more information about. The whole entire package deal can be a plug-and-play solution for our pharmacies, including the setup and bringing in the LPN or the RN to run the clinic. So a lot of programs that are being presented to pharmacies today are extra work for you, the pharmacist. This program is intended to be completely adjacent to what you're already doing and run by some other medical professional, but you own it. And so an amazing opportunity that doesn't create a whole additional workload for you or your staff. They will staff it for you and then turn it over to you once it's up and running. With just 2 patients a day, it's generating between 20 and 35,000 per month of new revenue to your pharmacy. So fantastic program. Happy to get you connected with them and learn what. Oh, the other thing I'll mention too is there are several pharmacies that are already waiting to get set up. There's 2 or 3 spots left to have this funded for you. So there's a pharmacy fund that's being set up so that you can make installments, because it's about a $30,000 investment, which, by the way, is a heck of a lot cheaper than even opening like a health franchise right now. I think it's like 150,000 startup and then a 50 or 60,000 per year franchise fee on top of that. So for 30K, you can set up the FOY or the Fountain of Youth clinic, and the ROI is like 2 or 3 months because you're generating that. But there is a fund that you can make installments, and it's paying yourself back because you'll be a member of the pharmacy fund, and now you're building equity in the fund as well as setting up your clinic. Crazy amazing program, and excited to get more of you details and information about that. I didn't see, is Cindy here today? Cindy Gordon. So Cindy helps small businesses bring down their health insurance premium costs. So by between 40 and 50% lower. So if that's something you're struggling with and trying to provide health solutions for your own employees, I can certainly get you in contact with Cindy. Other financial services are coming online for our community pharmacies as well. Because you're going to be generating 2 new revenue streams from your clinic and then also from the pharmacy fund, you're going to want to make sure that you're setting that up appropriately to either pass that on to the next generation of pharmacists in your family, or at one point when you want to retire and exit, you want to be able to keep more of that hard-earned equity and money that you have made. We are putting solutions together to help you with that whole process and walk you through how to keep more of your hard-earned money so that the federal government doesn't take half or more of it from you. And so looking forward to working on that with you too when you're ready. So we are coming up on 10 minutes to the hour here. We want to keep this meeting under the hour, but certainly would open it up to any questions that anyone might have now, or you're also more than welcome to reach out to me and set up a one-to-one to really get into the details and the weeds of all of the services that we've talked about today. I'll throw my contact information again up in the chat. And I saw that Phil Singleton put his information right above mine. Phil is the partner who is helping our pharmacy owners who are thinking about their exit strategy. Keep more of your hard-earned money. He's with Pacific Advisors and is a great wealth manager that we highly recommend. But open it up to any questions at this time that you might have. Otherwise, if you look in the chat, you'll see that there's, the Calendly link will actually open up my calendar, and you can find a time that is convenient for you to do a one-on-one and really dig into any one of the opportunities that are here. For me, the no-brainers are, you absolutely, regardless if you're not ready to do full clinical services, you still need to do my RX Spark, because that doesn't cost you anything other than a little time and educating patients on that. But that's going to just be some passive revenue for your pharmacy. Bring in any one of the new front end solutions that we've talked about, like the MyShield product or the Breath Rocks. Any of those are just seems like let's go ahead and get started with something. Do something today that's going to help offset the poor reimbursements or help you deal with whatever the DIR fees are going to be for 2024. Our pharmacists are amazing. They're wearing 30 different hats all in the same day. You're the marketing expert, you're the sometimes the janitor even, and so we realize that you cover a lot and are doing a lot, so we want to help any way we can. The ServeRx program, of course, our program, it doesn't cost you anything at all to get set up with that, but probably costs you quite a bit if you're not using it. So if you got to teach your techs that just because a patient came in and presented some card, make sure that it's actually a network that you are in, because if they just take any random workers' comp card, you might as well just open up the till, take out $50 or $60 and just light it on fire. So thank you again for being here. I'll hang around for a few minutes for any questions that anyone might have. Thanks to our presenters today. Appreciate all your help in making the presentations, to Scott and to John, to Jessica, Will's amazing. If you guys haven't met Will yet, this guy, I thought I had traveled the world, but this guy has been to like 180 something countries, and yeah, so he played with the Harlem Globetrotters for about 12 years, and so he's been in every major city in the US and over how many countries, Will, are you still with us? Like a bunch of countries that he's been to, countries I hadn't even heard of before. So if you ever want any recommendations on where to travel, he would know what cities and what countries are the best. And but just an amazing guy. So glad to have him on our team too as well. And he says he's an account manager. He's one of our directors. He's more than just an account manager. How do you pronounce your name? You're on mute, so if you want to come off mute, there we go.
Yeah, can you hear me?
Yes.
Oh, okay. Good morning. My name is Ndidi Amaka Bareke, but I go by Didi.
Didi. Wow,
Yeah.
that's way easier for me to say then. Thank you. But yeah, you're active on social media, so thank you for doing that. That's great.
Thank
I
you.
wish more pharmacists were like you. Now you're a PharmD?
Yes.
Awesome. Where did you go to school?
I graduated from the University of New Mexico College of Pharmacy, class of 2008.
Awesome.
Yeah.
Awesome. Yeah.
Yeah.
It's so wonderful that all of the schools have switched over to a doctorate program now.
Mhm.
So all of our pharmacists are coming out with doctorate degrees. So
Yeah.
Dr. Didi in the house. So thank you for being
Yeah.
here.
No, thank you for the information. I think, so I own a compounding only pharmacy here in New Mexico.
Yep.
You know, initially when we first started this meeting, I was thinking, well, maybe, you know, the majority of the information wouldn't apply to my practice, but actually all of it does apply. Just the fact that there are so many options to bring in revenue, even though I don't dispense any retail products at all. And then I'm actually building a new facility. And so in that new space, I really want to use one of the consultation rooms as kind of like, you know, like a mini wellness clinic. And I appreciate the information that was presented on that. So I'll sign up on your calendar so that we can maybe go a little bit more in detail as to what services I can employ to start generating more revenue on that end.
Yeah, absolutely. And the beautiful thing about creating this co-op is you still are independent. You can decide what makes sense for your patient demographic. So you don't have to just automatically take everything that we say is included in the wellness hub. Pick the things that work for you, and then you can always add. And we're constantly adding new vendors that want to partner with us because we literally will be the largest footprint in the nation to have wellness solutions available to 98% of the country in 10 miles or less.